My name is Alex Satin. I'm a spine surgeon at Texas Back Institute. Today, we are at the Orthofix headquarters to use their 7D navigation system for posterior cervical instrumentation. The 7D system uses optical topographic imaging for rapid, radiation-free registration of the exposed spine. The 7D system projects a structured light pattern onto the field, creating a 3D surface map that is then matched to a preoperative CT scan. This allows for intraoperative navigation without the need for any additional intraoperative radiation. The registration is generally quick and can be easily repeated. It is performed off native bone. In revision cases, the registration can be performed off previously placed hardware. The 7D system pairs well with the NorthStar OCT system, particularly with preoperative planning, as you can see the exact dimensions of the tulips and screw. Preoperative planning enhances intraoperative efficiency and allows you to line up your tulip heads to facilitate rod placement. In my experience, the 7D system dramatically reduces the intraoperative mental and physical burden during instrumented posterior cervical fusions. This technology does not eliminate the need for understanding anatomic landmarks, instrumentation techniques, and careful evaluation of preoperative imaging. Meticulous decortication and bone grafting are critical to achieving a successful arthrodesis. Furthermore, in these cases, instrumentation is typically performed in conjunction with the decompression, which is both technically demanding and critical to achieving a safe and successful outcome. In my practice, I've utilized freehand techniques, fluoroscopic guidance, and other CT navigation systems, including robotics. I think the 7D system has distinct advantages, particularly in the cervical spine. The cervical spine is generally mobile, which can create issues with other CT navigation systems. With 7D, each level is individually registered, which mitigates this issue. When using 7D, I will frequently reposition the array and my retractors during the course of the case, as optimal alignment can vary from the upper cervical spine to the cervicothoracic junction. With other systems, this is not possible as it would necessitate a repeat scan or re-registration. Anyone who's used navigation technology has an instance where the array has been bumped and moved, which can compromise accuracy. With the 7D system, a flash fix can be performed in seconds, and you can proceed with the surgery without much delay. We'd like to demonstrate the flash fix. And so, as you can see, we have the navigation probe in the pedicle, and everything looks fantastic here. But if we go ahead and move the array, you can see how, despite not moving that probe, things could look very off. And so one of the additional advantages of the 7D system is the ability to perform a flash fix. And so we'll go ahead and resecure our array to the spinous process, and then let's go ahead and get a flash fix. Okay, we'll recheck our accuracy, and that looks outstanding. And then, once again, the accuracy of the 7D system has been restored in only a few seconds without the need for an additional intraoperative spin. Well, we're going to now proceed with a left-sided C7 pedicle screw. When using freehand techniques, it is very common to make a laminotomy to feel the medial border of the C7 pedicle. If you feel that that's necessary, certainly can take that step, although since using 7D, I don't typically do that. We'll once again start off with our flash registration. It's important to try to take an orthogonal approach with the array. So we'll go ahead and get our flash for C7. So we'll go ahead and pick our points: left, center, and right. Excellent. And then once we pick our points, we'll check the accuracy. I usually like to start off with the spinous process. Excellent. As well as the facet joint above and below. And so typically at C7, it's not possible to place a lateral mass screw. The starting point for the C7 pedicle is typically 2 millimeters lateral and superior to the center of the lateral mass. And so we have a favorable starting point here. Excellent, so that looks great. I'll typically take the high-speed burr at my starting point to create a favorable resting place for the drill guide, which we have set to 24 for a 3/5 24mm screw. Excellent. Four cortices of bone and a solid end point. I'll take a tap. C7 pedicle screw is typically 30 to 40 degrees medial and in line with the end plate. Okay, go ahead and tap this. Excellent. I'll take the screw, please. Typically have my assistant checking the navigation, although I try to keep my arm and angle flexed to avoid any deviation. You can then check your screw trajectory, which looks outstanding. Excellent. That looks great. And so we're going to now use the 7D navigation to place a right C3 lateral mass screw. Obviously, freehand techniques can be used for lateral mass screws in the subaxial cervical spine. However, navigation does give us the ability to place longer and larger diameter screws in some settings. Multiple techniques for lateral mass screws have been defined, including on, Maggerel. In general, you can divide the lateral mass into 4 equal quadrants. A commonly described starting point is at the just inferior and medial to the center of the lateral mass, with an approximate 20-degree lateral trajectory and a 30 to 40-degree cranial trajectory. The screw is placed in line with the facet joint, and that can serve as a reliable guide for the angulation of the screw. Excellent. So we have our starting point. So we can use our navigation probe to confirm that we like the trajectory that we drilled. This looks safe and accurate. Excellent. So we have now successfully placed a 3/5 18mm lateral mass screw at C3. So we're now going to place a left C2 pedicle screw. And so up to 30% of patients do not have anatomy that's amenable to a pedicle screw at C2. And so careful assessment of preoperative imaging is paramount. The C2 pedicle connects the vertebral body to the articular facet. The C2 pedicle is generally inferior to, or defined as inferior to the superior articular process and anterior medial to the transverse foramen. C2 pedicle screws have twice the pull-out strength of PARS screws and are typically 18 to 24 millimeters in length. Okay, so we have picked our starting point, and that looks excellent. In general, the starting point can vary from person to person and side to side, but is usually on the superior medial aspect of the lateral mass. And so we like our spot. Great. And so I then take my burr and we'll create a favorable resting point for the drill guide. Excellent. The C2 pedicle screw is generally 20 to 30 degrees medially directed and 20 to 30 degrees cranially directed. So next, take a navigated tap, please. And the screw, please. Excellent. That looks great. So with C1, it's imperative to look at your preoperative imaging to understand the adjacent neurovascular structures, particularly the vertebral artery as it passes above the posterior arch of C1. Another important consideration is the venous plexus that overlies the C1-2 joint. In the cadaveric setting, we were able to take care of that, and we also sacrificed the C2 nerve root, which can be done intraoperatively. Another alternative to preserve the C2 nerve would be to move it caudally. And so once we verified that we like the accuracy, which we have, I usually palpate the joint and make sure that we like that as well. And so now we can find the starting point for our screw and palpate the medial aspect and lateral aspect of the C1 lateral mass. In general, the starting point for a C1 lateral mass screw is at the midpoint and is aimed approximately 5 to 10 degrees medially and aimed at the anterior tubercle of C1. So typically 1/3 of the screw will be outside of bone so it lines up, and that 1/3 is typically a non-threaded screw. So now that we've identified that, I will typically begin with a navigated burr, which was registered before, and make sure that we like our starting point here. Excellent. And so there are multiple diameters for the drill depending upon the desired screw. And so the rigid drill guide is very accurate. Excellent. The other thing that I like to do is you can use this rigid navigation guide after you drill to just confirm that your registered instruments continue to be accurate. And so that looks outstanding. And so we're going to put in a 3/5 screw here. Okay, I'll take the screw, please. I'm going to do a 3/5/26 with 16mm thread. Thank you. So now we can match up everything on our screen here. Great. You know, one of the things this cadaver, you can see that there's a bit of rotation, but fortunately we were able to correct that operatively. Excellent.